What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. One of the main advantages of being a direct care specialist for my patients is the time savings. And this particular episode comes off of a week where I spent a lot of time as the physician trying to get in touch with other practices, advocating for my patients. So I thought it would be a good time to do an episode about the value of your time and how a direct care practice like mine can save you time. Let's take an example of someone who has back pain. This is, of course, kind of a debilitating back pain. So let's say that you're kind of doubled over. The first thing you want to do, ideally, would be to call your primary care physician and see if you can get an appointment the same day. Now, one of the main problems is that when you call into clinics, it's very difficult to get a human. We've all been there where we hear the annoying music and have to hit a number of automations to get to an actual person, only to have them ask us the exact same information. And in this past week, I spent almost, I'd say 25 to 30 minutes trying to wait for someone to get on the phone. And that's just getting started. So many people have experienced this and said, you know what, I'm not going to even try and bother and call my primary care, and I will go to a local urgent care. And that's sometimes a pretty good place to go. However, there's still a wait time for some of these urgent cares. Anywhere, at least that I've seen, has been somewhere between 15 minutes to an hour to be seen. In these settings, they do have a purpose, and when it comes to back pain, oftentimes people will come away with an x-ray and also some anti-inflammatories, and then they're sent on their way, and hopefully that works. But they don't have anyone in particular to follow up with, and as a result, they have to either call their primary care physician and or get referred to see a particular specialist. Now, there are certainly options in that case. Some people can go and see like a physical therapist right away, which in my opinion is probably one of the best things that you can do. I love my physical therapist. Everybody knows that. There is direct access in most states. At least that's a potential option. But unfortunately, sometimes you need a referral. So here we go back into your primary care physician, which, again, I'm not trying to bag on primary care physicians. Primary care is one of the major stress points in today's healthcare system. So I definitely feel for my brothers and sisters working in the primary care clinics. It's tough. It's a tough job. That being said, let's assume that you get onto the phone with somebody after waiting, let's say 20 minutes, and you try and make an appointment. The next available appointment hopefully will be within, let's say, best case scenario, within a week. In my personal experience, it usually takes a little bit longer than that, but let's say you have a little bit of a pull, you get in within a week. Hopefully you're able to work, and in some cases you're not able to. And let's say they have a cancellation and they bump up your appointment and you're seen the very next day. Perfect. You get into the waiting room, you check in, and the average waiting room time for some places is somewhere between 15 minutes to even an hour. And that's a long time. Again, you're not there for fun. It's time off of work. Even in the best case scenario, you finally get brought back. And I just had a patient say that they finally got brought back only to wait another 90 minutes. Now, realistically, at least in my experience, I've waited somewhere between 30 to 60 minutes while I'm actually inside of the room waiting to talk with my doctor. And come in, they do an examination. They make a recommendation. It's kind of a wham bam situation. You got to be out of there in less than 10 minutes, and then they move on. And so a lot of times you get referred out not only for an x-ray, maybe for physical therapy, maybe for an MRI. Now, again, if you get referred out to see a physical therapist, I've had pretty good experience, at least locally. Most PTs in my area can get people in within a week, which is great. Now, let's say that you end up going to physical therapy, you get in 4 to 6 sessions, your symptoms are not improving. So you want to go back. Now you have to go through this all over again, try and get through the phone system. You finally check in and you're back into the room. Now, in real time, we're talking probably 6 weeks into this particular episode. You get referred out to go get an MRI. In my area, to get an MRI actually scheduled on the books, it can take somewhere between, I would say on average, about 3 weeks. But the challenge from my standpoint is getting the MRI referrals to be received. In my practice, I personally send the referrals, and then I call the practice to make sure. I call the imaging center to make sure that it was received. And that's where I spent a lot of time this week, was on hold trying to verify that these MRIs actually went through. And unfortunately, sometimes I get through and the person on the other end says, no, we didn't get it. And I tell them I personally faxed it. And then I fax it while they're on the phone, and then miraculously it appears. From that scenario, the person gets scheduled, let's say in 3 to 4 weeks. You finally get the MRI. You may or may not be doing treatment in the meantime. You now have to make an appointment to see your primary care physician in order to go over the MRI findings. You now have to call the primary care physician's office again. You have to go through the automation system. You're back in the waiting room. You're back in the clinic room again. Again, that's several hours. You finally get to see your physician. They end up, let's say that you have an obvious lumbar disc herniation. Can be a pretty bad problem, and you will typically need, not just physical therapy at this point, medications, but then also to get referred to see a specialist. Now, to see a specialist in my area, it can vary pretty widely. I've seen people go for an epidural injection, and the wait time to see a pain specialist can be somewhere between 2 to sometimes 6 weeks. Sometimes to see one of the spine surgeons, they can get you in within 2 to 4 weeks, but it may not be with them specifically. It might be with their nurse practitioner or their physician assistant. Usually in that particular scenario, if you're seeing by someone other than the surgeon, there's usually another visit after that to actually follow up with the surgeon to go over the game plan. So as you can see, that is a lot of waiting, just for something that's relatively simple. One of the big reasons why I have opted for a direct care model. In a direct care model, let's use my clinic as an example. When you call the phone number, you get me specifically. You don't get an answering service. You don't get a receptionist. You get me specifically. From there, I can look at the schedule in real time and tell you the visit availability. I would say 99.9% of the time, I have availability within 24 hours. And if I see someone past 24 hours, it is usually to accommodate their particular schedule. I also provide virtual visits. Even as a new patient, I have access to all the major medical record systems, so I can gather all that information in addition to the imaging. So given all of that I've just described, we're talking the wait time to talk to the receptionist, the wait time in the waiting room, the wait time in the actual clinic, the wait time to be referred to see a specialist, the wait time for follow-up, to go over your overall game plan. I mean, we are literally talking sometimes months just to kind of get all that straight. And then in a direct care model, a majority of that has been simplified. It becomes a lot easier to manage, to just simply give you the care that you need. Now, there are some uncontrollable factors that I don't have any issues And that's what I wrestled with a lot this week. Some of the common things I run into is that there's just simply a shortage of staff, not enough people to answer the phones, not enough time in the day to handle the patient load. Because again, some of these clinics are seeing, you know, 40 to 60 patients per day. And again, I'm not bagging on anybody. This is just the nature. This is the way our healthcare system is. It's not a specific problem. This is a generalized problem across the board. There's a shortage. There's just not enough people. And then there's also the human factor of that. Sometimes you get people that just simply don't care to do a good job. I wrestled with that this past week. That I faxed something with confirmation 2 or 3 times. I know I did it. I can see it. I talk to the person. They say they never got it. And then I fax it to them again while we're on the phone, and then magically it appears. Now, I've worked in these offices. I know that a lot of times people just simply just say no. They never got it, because it is way easier to say that than to have to go look for it. I've seen people say that they never received the fax because there's like a stack of papers that they just didn't want to rifle through and then look for that specific referral at that particular moment in time. Again, sometimes it's the person, but sometimes, again, you just don't have that much time to rifle through all those paperwork. So if you've ever wondered what took so long, or why, my doctor referred me to someplace, I just never heard back. There's so many factors that can't be accounted for. Did the referral go through? Was the referral even sent out? Was it actually received? Was there paper in the fax machine? I mean, these are unfortunately real but extremely stupid problems that the system kind of tolerates. Just in my opinion, it's unacceptable. And it's the main reason I decided to take myself out of it. I want to deliver excellent patient care, efficient care, personalized care. And as I practiced in that system, it just didn't make sense to me. There were just so many factors that went into the process of trying to help somebody. Delaying care just simply because someone can't figure out the automation. They hit 1 instead of 2, or you wait 30 minutes and then all of a sudden it automatically hangs up on you. It's happened to me too. It happened to me this past week. I was on the phone literally for an hour waiting to talk to someone at an office, and it just hung up on me. I received a lot of calls this past week, and a big question that they have is, how much is your first visit? And people get very stuck on that, and as they should. I'm not oblivious to the fact that the level of care that I provide comes at a cost. I charge $350 for the initial evaluation, but that's also to go over everything we just discussed. I take care of gathering all the information so that my patients don't have to call to fill out a release form and have to go get the records themselves. When I refer people out, I'm the one who sends it. I follow up on it. I make sure that things actually go all the way through. So from that standpoint, I know I help my patients along, because not only am I efficient, but I take a significant chunk of the responsibility out of their hands, and I take it. I've definitely met some people that say, well, I don't do that. I'm a doctor. I'm like, to me, that's bullshit. Sure, you're a physician. You know how to operate a fax machine. If you're going to take care of somebody, take care of somebody. So while some people get stuck on my price, I'm like, well, how much is your time worth? If you come and see me, I can literally save you weeks to months of frustration just to get a piece of paper into a fax machine across to different specialists. Now, I'm not even getting into the fact that a lot of the tools I have within my office, I can negate a lot of unnecessary referrals. I'm not even going to get into that on this particular episode, but I just wanted to share this experience that everybody, at least in the U.S. healthcare system, anyone who's ever participated in this system has experienced. And that's from both ends, the patients, the physicians, the physician assistants, the PTs, everybody. We've all experienced this. We're all frustrated. I'm trying to create a system that makes it simpler for my patients. Everybody acknowledges that this is a problem. The default as it is unacceptable. I want to create a pathway for other physicians that share a similar vision or share similar frustrations. I want to create a pathway for them to practice. And it is going to be within a direct care model. You have to take insurances out of it. And we didn't even get into the authorization piece of some of this stuff. That's a completely different animal. I wrestled with that this past week as well. But it's not just money, is the bottom line. It's your time. It's your time away from doing things that you love. It's your time away from you making money by taking time off of work. It's your gas. It's getting to and from these appointments. Care should be simpler. That's just the bottom line. It should be simpler. Anyhow, I hope you guys have an excellent 2025. I'm hoping that you guys have a movement-filled year. Please let me know if I can be of any assistance. Take care. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.